Welcome to Ask Dr. Z. Today we'll be talking about decoding melatonin, your questions answered. People call me Dr. Z. I'm a longevity physician and creator of Optional Aging Academy, a framework for longevity. Today we'll be talking about melatonin. It's one of the most common sleep supplements. Its true nature and proper use is frequently misunderstood and misrepresented. In this session today, I'll answer your questions about what melatonin dose is, what's the safety profile, dosing strategies, and why it may not always work, and what else people can do for their sleep. At least we'll hint at that. First question for the session, what is melatonin actually supposed to do? So melatonin has several functions in the body. It controls the circadian rhythm. It's a primary circadian rhythm signaling. It helps signal the body that it's nighttime and the brain should get ready for sleep. That's only if it occurs at night. I'll get to that a little bit more. It's not a traditional sleep pill. Not put people to sleep. It cues your body up for sleep. It's ready for sleep. Meaning that if you take melatonin during the day, it usually doesn't cause sedation, unlike sedatives. So it's not a sedative agent. It's more of a darkness signal. It doesn't knock you out. Now there's many functions beyond its use as a sleep aid. Like I said, circadian rhythm, a regulator, opposed to cortisol. So melatonin surges at night and then kind of falls off, and then in the morning you get a surge of cortisol. So people who have circadian rhythm dysfunction typically have cortisol and melatonin switched. But people don't know melatonin has strong antioxidant effects created in the mitochondria, or it's used in the mitochondria to help support mitochondrial antioxidant functions. It's thought to also be an anti-inflammatory. We're still understanding some of these mechanisms for melatonin, but it's used beyond sleep, something that we're actively studying, and it's a very exciting part of research. So in terms of the use of melatonin, like I said, the 6 a.m. wake-up cycle, melatonin is almost always all shut off by that time, and you get a surge of cortisol. By noon, cortisol tends to drop a little bit, slowly drop over time. Melatonin is almost non-existent, at least when it comes to the brain signaling. 6 p.m., depending on the season, that's usually when the sun starts to go low in the sky, your brain starts to create more melatonin. And then 10 p.m. is thought for most people when peak levels are reached. Again, that could be seasonal as well, depending on the light cycle and whatnot. 2 a.m. is where we see deep sleep starting to occur in most people, and then the cycle repeats itself with a 6 p.m. drop in melatonin and surge in cortisol. So one of our users asked, does melatonin actually help people sleep? Well, it depends. Sometimes it does. It's a very commonly used sleep aid, but again, it goes well beyond sleep. What it typically is used for is sleep onset. Now there's an immediate release and there's extended release. The immediate release is usually helps, you take it around 9, 10 o'clock at night. That's kind of where the brain is supposed to have a surge of melatonin. Some people who have circadian rhythm issues or cortisol might be surging instead. Melatonin can help a little bit with that. But that's really all it can help with. So it only helps a very specific set of circumstances for sleep. And it only helps for sleep onset. Now there are extended forms of melatonin that in some people can help them stay asleep, but typically the immediate release helps with initiating sleep to begin with. Now there are times when it can help more than others. So where it's thought to be most useful is jet lag and related sleep disturbance, because you're traveling and the sun's setting at different the first week or two, timing it for your new time zone. So taking it around 9 or 10 o'clock in your new time zone can really help. Delayed sleep phase or shift cycle, people who work different shifts and their sleep cycle gets disrupted. For example, nurses might work 1 month of nights, 1 month of days, and so melatonin can help kind of bring their sleep back to back to a better phase. Trouble falling asleep, we talked about this. This is where there's might be a circadian mismatch. It can help with circadian mismatch. It really all depends on what else is going on, and then regular schedules as well. Where it's less likely to help, sleep issues related to anxiety could help a little bit with sleep onset, but typically, other treatments are needed or other interventions are needed. Anything related with pain, wake people up at night, or anything with sleep apnea doesn't seem to help. If you take my module on sleep dysfunction, you'll know many times I talk about avoiding alcohol. Melatonin probably won't overcome a bad sleep related to alcohol. So this student asks, what dose should adults take? So this is very controversial. I have different opinions on what doses to take. And people often take too much. So lower doses are thought to be physiological, and many over-the-counter doses are not. You'll see over-the-counter 1 milligrams, 3, 5, 10. I've seen as high as 20, 40 milligrams. They are super physiological. Now, like I mentioned, there might be other reasons for people to take super physiological doses, but when it comes specifically to help sleep onset, usually you want to stay under 1 milligram. So maybe 300 micrograms, which is like a third of a milligram. That tends to be a more physiological dose. So typically you can get like a liquid formulation or a low dose tablet, 1 milligram tablet, break in half, break quarters. They also sell a variety of different doses. So the key is, higher dose is not always better. Where it can make a difference is with jet lag. There is kind of a common dosing schedule, not really backed by much science, but backed more by opinion from some people out there, that you can take 1 milligram per time zone. So if you're traveling 5 time zones, let's say from New York to the UK, it's about a 5-hour difference. So you would take 5 milligrams of melatonin and kind of go down from there. That's pseudoscience, but those are some of the guidelines that I've heard from people that I trust in the field. And the good thing about melatonin, it seems to be very, very safe. I'm not aware of any toxicity to it or any issues with taking too much, but more is not always better. Like I said, there are some circumstances where more may be important. As we kind of understand its role beyond sleep, we might find that there are some people out there. But today we're just talking about sleep. Again, to kind of go over the doses, around 1/3 or 0.3 milligrams, that's close to a physiological dose for most adults. 1 milligram is still considered to be a low dose, but you're starting to get there, double, triple what people need. Milligrams, 5 milligrams, those are common over-the-counter doses, and there might be circumstances, but most people don't need those high of doses. Taking too much may cause some grogginess in the morning, depending on how long that melatonin stays around. All right, the next question asks, when should melatonin be taken? Timing matters as much as dose. We kind of talked about this already in the previous question, but you want to kind of time it for the natural function. So it tends to peak around 10 p.m. If somebody is following a normal sleep schedule. If somebody has shift work and they want to get to sleep in the morning or in the daytime, making everything dark, that's the most important thing. Light will counteract the effects of melatonin. And so if somebody just gotten off a shift and they don't feel like they're sleepy, but they need to sleep in order to function, then they can wear the blinders, get the room dark, and they can take some melatonin. Now that doesn't work if you're only doing 1 or 2 days typically. That only works if you're going to be on shift work for a while, like jet lag. It takes a few days for the body to kind of reacclimate. But melatonin is thought to help reacclimate for jet lag. It helps speed that process up a little bit. And the most important thing is also making sure you're coupling melatonin with some sleep hygiene in terms of dimming the lights. Right now I got a lot of lights on right now because I'm recording, and it's morning time right now. But if this were evening time, I probably wouldn't want to be recording in front of such bright lights because it would signal my brain that it's not yet time. So the best time to take is usually around 8 o'clock, 9 o'clock. By the time it absorbs, gets into the brain, then that can help augment or supplement the natural melatonin that might be missing in some people, or some people just find a little higher dose can help. Why do some people feel groggy or weird the next day? There are several reasons. First of all, dose might be too high. Maybe just some people don't metabolize it as quickly. It could stay around longer. Taken too late. A good time to take is 8 or 9 o'clock. If you start taking it 10, 11, 12, it could disrupt the sleep cycle and cause problems. It could be the wrong formulation. We talked about extended release versus immediate release. So there's a time and place for both. Some people might be more sensitive. Like some people are sensitive to alcohol, or some people are sensitive to sugar, for example. Some people might be sensitive to melatonin. So there's not a universal dose. So the doses that we talked about earlier are more guidelines rather than individual doses. Right. A question I commonly get: can you trust the dose on the label? It really depends. OTC products, over-the-counter products, are known to vary widely in terms of their quality, their manufacturing process, their testing processes. So not every brand out there is reliable or trustworthy. So typically when I recommend supplements that have undergone third-party testing, USP, NSF. These are kind of accreditation bodies or testing bodies that can help verify whether the supplement has what it says it has, and not too much and not too little. Otherwise, if you buy some no-name brand or some unreliable brand or brand that doesn't undergo third-party testing, there's really no way to know whether or not you're getting what's on the label. So it's buyer beware, so to speak, at that point. Is melatonin safe to take every single night? And why doesn't it work for some people? So let's go through the every single night. I know of people who've been taking melatonin every night for years, and they swear by it. They think it helps their quality of life. They think it helps their sleep quality. And it, again, seems to be fairly safe. Short-term use, very well studied. We have a lot of trials on melatonin safety for short-term. Longer-term, nobody's really studied it. Not that I'm aware of anyway. It seems to be safe long-term, but we don't know for sure. There is a debate among the community whether or not taking exogenous melatonin, supplemental melatonin, shuts off your natural melatonin. And there's two camps. One camp says, no, it doesn't. There's no exogenous feedback loop to shut it off. And others say there might be. The data I've seen seems to indicate that there's not. There doesn't seem to be a shut-off loop. And part of it is probably because it's not just a sleep hormone, it also has these antioxidant effects and whatnot. So I think it makes sense from a physiological perspective that there may not necessarily be a feedback loop. So it does appear to be safe long-term. I know reputable physicians and health-conscious people who've taken melatonin for years. And there's some thought it could potentially help with gray hair. I take it now and then, but not every night. But I've also seen it available in a topical formulation, and it seems to help stave off or maybe even reverse some aspects of gray hair. So again, there's a lot that we still don't know about melatonin. It seems to be safe, but I would say if you're needing it every night, if somebody's needing it every night, then there might be something else going on that they're not addressing. There's not necessarily a physiological dependence, but there might be more of a psychological dependence, meaning the person might think, oh, I didn't take my melatonin or ran out of melatonin today, I'm not going to be able to sleep. And that can be a very powerful placebo or nocebo effect. So that's something I caution. Just like any supplement, any intervention, it needs to be used strategically. And then the question about, does it help for everybody? If somebody has problems with their bright lights all the time, loud noises, they might live in cities where there's lights everywhere and they can't turn off the noise, melatonin is probably not going to help very much. If somebody has pain, inflammation, melatonin may help a little bit with the inflammation, but not necessarily the pain. If somebody's on medication that messes with their sleep, or if they drink alcohol, then melatonin is not likely to happen. And of course, if they have any sleep issues, stuffy nose, sleep apnea, enlarged tonsils or something like that, then melatonin is much less likely to help. And then if you have something going on with the nervous system, easily triggered, too much anxiety, again, it's probably not going to help calm down the anxiety. Okay, that's it for our question and answer session today. I hope you found it useful. Please comment below with your questions. What I try to do is I try to collect all the questions, and once I get enough questions on a particular topic, I'll go ahead and shoot another video like this, so you could be featured and your question could be featured in my next video. If you like this information, please feel free to subscribe to this channel. Follow me on the other social media channels where I'll try to post more and more content. Of course, you can find me at optionalaging.com, where you can learn more about the drivers of aging. You can share this video with anybody you think is helpful. Thanks for tuning in, and we'll see you next time.